This research was done in cooperation between Tufts University and Solidarités Internationale. SI is the lead of the cholera task force in Borno State in northeast Nigeria, and they developed monitoring tools for cholera-related WASH activities through the COBO toolbox. The methods for this evaluation was database analysis and key informant interviews. And the results showed that about 50% of the activities reported were for cholera preparedness, about 40% were preventative activities, and about 10% were response activities. As you can see on the chart, the number of activities reported varied by organization, by month, and by local government area. More than 30% of the activities were reported by one organization and reported in one LGA. And more than 50% of the activities were reported in 1 month. So the implementation numbers may be biased because the one organization that reported the most activities is correlated to the months and the LGA that have the highest numbers of activities reported. Also, 4 organizations reported very infrequently, and they represent less than 1% of all activities. So it may not be representative of the activities that they actually implemented. Also of note is that no organization reported every month, and that the number of forms varied a lot per day, from 0 to 132 forms in one day. With the key informant interviews, 8 themes emerged, with the results indicating that the collection process was not clear to all informants, especially in terms of frequency and forms use. The task force partners were trained on the form and platform use over one meeting, and then they trained their own teams. But despite this training, informants noted that some questions still needed clarification. The data that was consolidated was then presented during the weekly meeting through a visual dashboard, and more than half of the informants reported that their organization was using the data to adapt their programming and to improve their cholera response. 6 out of the 7 informants reporting that the cholera monitoring was then improved thanks to the tools, and that it allowed them to know the gaps in real time, and it resulted in a better coordinated response. And 5 out of 7 informants said that the monitoring tools were easy to use. In conclusion, unclear and undefined data collection processes and insufficient training, in addition to some ambiguous questions, led to inconsistent data collection. The data was difficult to study collectively and consistently. However, monitoring helped reduce response gaps and improve coverage of activities, and the organizations were able to adjust their implementation strategy and to coordinate with other task force members thanks to the monitoring tools. But the data could not be used to assess the overall sector preparedness and response to cholera, nor to improve specific implementations. As a recommendations, we recommend increasing the quantity of data reported through the support of organizations that have less experience on monitoring activities, and also by making reporting a grant requirement. To ensure data consistency, we recommend having closed answer questions with a fixed number of with a fixed choice list of answers, and to have regular refresher trainings for the data collectors on the reporting process. And finally, to improve data relevancy, we recommend expanding the current monitoring forms from activity metrics to include questions with outputs and outcomes. So these recommendations may be applicable to monitoring for many types of humanitarian response activities, and they can help ensure that monitoring tools produce sufficient and reliable data to improve WASH response in outbreaks in general.